The renal artery. The renal artery normally are of the seat of the abdominal aorta immediately below the superior mesenteric artery and supply the kidney with blood. It is directed across the grooves of the diaphragm so as to form nearly a right angle with the aorta. The renal arteries carry a large portion of total blood flow to the kidneys, up to a third of total cardiac output can pass through the renal arteries to be filtered by the kidney. Like the atherosclerosis that affects the artery of the left, renal artery disease is caused by the building of plaque in the artery that leads to the kidney. Plaque is made of fat and cholesterol, and acid accumulates in the renal artery is caused the artery to stain of narrow, which block the flow of blood to the kidney. Obstruction in the renal artery, known as arteriorenal stenosis, can cause purling from the left, high blood pressure, congestive heart failure, and kidney failure. Application in the medicine. The symptoms: high blood pressure that is not controlled by medication, and lifestyle changes, including diet and exercise, may be a symptom of renal artery disease. Symptoms of renal artery disease may also include episodes of fluid retention or congestive heart failure. In some cases, renal artery disease may be entirely asymptomatic. In several cases, renal artery disease may lead to kidney failure. Symptoms of kidney failure include weakness, shortness of breath, and fatigue. Risk factors for renal artery disease include age, obesity, diabetes, high cholesterol, smoking, high blood pressure, and family history of coronary artery disease, a family history of peripheral artery disease, a family history of renal artery disease, and neurofibromatosis.
We will discuss transradial approach for addressing renal artery stenosis. Renal artery intervention is well established through femoral as well as the radial route. It is important to understand that most of the patients are having significant hypertension which is uncontrolled even on maximal medication, and that is why the radial route should be a preferred route to avoid local vascular complication rate as compared to femoral route. And secondly, the origin of renal arteries from the abdominal aorta. If you go from the upper limb, that is through radial, the catheter alignment is always having better coaxiality as compared to the femoral route. This is a case of right renal artery ostial stenting using left transradial approach. The renal artery ostium was cannulated using a 6F JR4 guide catheter and the lesion was profiled. The lesion was then stented in usual fashion. This is the final result. It is important to understand that in taller patients having height more than 175 centimeters, it is a good idea to select left transradial route for addressing infradiaphragmatic lesions and make sure that you puncture high in the left radial artery. Higher puncture will save 7 to 10 centimeters of the length, and if you are working through left transradial approach, you are eliminating about 10 to 15 centimeter length of arch of aorta. This means that by using the regular hardware, you can fix most infradiaphragmatic lesions if you choose left transradial approach, particularly in tall patients. This is a case of right renal artery mid-segment stenosis, which was stented using right transradial approach. The lesion is profiled now. This is another view showing the lesion. Stenting in progress. This is a good end result. This is another view showing the result.
Diseases. Renal artery disease, more often related to peripheral artery disease, atherosclerosis in arteries outside the heart, or coronary artery disease. The balance is generally caused by fibromuscular dysplasia and congenital disorder that causes thickening of the artery walls without plaque build-up. The kidney plays an important role in regulating blood pressure by secreting hormone renin. If the renal arteries are narrowed or blocked, the kidney cannot work effectively to control blood pressure. Surgical treatment. With the development of new and improved types of stain, angioplasty with staining is the preferred treatment for renal artery disease. But in certain cases, surgical treatment may be necessary to restore blood flow to the kidney and preserve kidney function. Surgical treatment for renal artery disease include bypass procedure, which involves using enzyme from another artery or vein to construct or deter around the blocked area of the renal artery. Treatment. Renal angioplasty, a small catheter along the tube carrying a thin balloon is inserted through a small puncture in the groove and guided by X-ray to the kidney artery. When the catheter is guided to the narrowed part of the artery, the balloon is inflated. As it expands, it compresses the plaque against the artery walls, reopening the vessel for blood to flow through. Once the artery is open, the physician may insert a stent at the site to keep the artery open and support the artery wall. In carefully selected patients, renal angioplasty improves blood pressure and kidney function with minimal risk. It can be done an outpatient procedure of with only an overt state, does not require general anesthesia, and has a short recovery time.
Renal artery arises directly from the aorta, giving rise to an anterior branch which in turn is divided into 3 or 4 branches that supply the anterior canal and lower pole. There are also unique posterior branches supplying posterior and upper pole of the kidney. The renal artery hides of the branches that supply the adrenal gland and perineal fat. When it enters the renal parenchyma, the renal artery branches that penetrate outward freeze the renal papilla, ending at the bases of the renal pyramid forming and vascular bed. Where dilated arteries arise, arteries emitting renal glomerulus. Its function is to move blood through the glomerulus and then filtering blood. Removing was pH, balance and blue volume. Side branches are inferior capsular artery, upper urethral artery capsular. The asymmetric are. Renal artery stenosis is caused by narrowing of the vessel walls. Decreasing blood flow and glomerular filtration causing also renal failure pre-renal. Other pathology are hypertension, canal obstruction, etc. Discriminating univolume, accumulation of the fatty acids caused by acidosis. In Ecuador, may quick-volume catheterization renal. Also use drugs such as vasodilators, anticoagulants, diuretics, etc.
The kidneys are a pair of small, bean-shaped organs located towards the back of the torso and behind the lower ribs. The functions of the kidneys include filtering waste from the blood, balancing the body's fluid content, and regulating blood pressure. Normally, blood enters the kidneys through the renal arteries and then into smaller arterioles, which lead to individual filtering units called glomeruli. If a renal artery becomes narrowed due to injury or disease, a condition called renal stenosis, blood flow to the glomeruli will be reduced and the tiny arterioles will sense a decrease in blood pressure. When this occurs, cells that line the arterioles release a hormone called renin into the bloodstream. As renin enters the bloodstream, it causes arterial constriction, not only in the blood vessels of the kidneys, but all over the body, thus increasing the body's blood pressure. Renovascular hypertension is a serious medical condition. If left untreated, it can lead to organ damage, including damage to the heart and the lungs.